Hello, friends, and welcome to the Optimized Advisor Podcast, where we focus on optimizing the well-being and best practices of insurance and financial professionals today. On this show, our objective is to help you optimize your life, optimize your profession, and learn from other optimized advisors. I'm your host, Scott Heinila. We hope you enjoy the show. On today's episode, I had the good fortune of interviewing Randy Platt, co-founder, chairman, and CEO, and Rodney Burris, co-founder, president, and COO of Care Partners. Care Partners is an organization that specializes in transitional medicine, care management, home care, and senior placement. Their motto is bridging the gap in healthcare, coordination, continuity, and connection. So we dove into their practice, how they got into this business, their long tenure in the healthcare services arena. We learned a lot about this, as well as many other things on how to build an optimal and successful practice in today's world. Hope you enjoy. Good afternoon, gentlemen. How are we today?
Hey, Scott.
Doing well. Thanks for having us.
Great
Rodney Burris. Hello.
Hi, Scott.
And Randy Platt.
Hey, Scott.
Gentlemen, co-founders of, hold on here. Post-acute care partners.
Oh, yeah, we should probably get you right on that. It's now Care Partners.
Okay.
Yeah.
All right here. Care partners, and we got the care partner at home.
Yep.
Okay. First of all, explain me your practice and how we can distinguish post-acute care partners and care partner at home.
And there's a couple more you didn't even name, so we'll tell you about those as well.
Enlighten me.
Sure.
Or maybe we can get to that in just a moment. Rodney, you and I have briefly met. Before we got into this conversation, Randy, you and I were talking about how long we've known each other, which is about 4 years.
Yep. Just 4 years.
Fun story. Which by the way, I would love to get into your engagement and involvement in that senior community.
Sure.
Formerly Senior Serve, the organization we now know as Meals on Wheels Orange County. You've done just a phenomenal job in your efforts within that organization now as volunteer, but previously as, the CEO of that company. So we can certainly get involved in that.
Love to share that. I think you and I have a lot to talk about, a lot in common when it comes to Orange County Meals on Wheels.
As I was also expressing, Rodney, one of my first questions and personal interest is figuring out how in the heck did you meet Mr. Randy over here? What is that story? How have you guys came to be?
It's a good question, Scott. And I'm glad you've asked me and not Randy, because we have two different versions.
We do.
And I think it's the humbleness that comes from Randy in that, because something he usually leaves out is he was formerly my boss.
Oh,
that's how we came
at
together.
Silverado.
At Silverado.
Got it. Okay.
So Randy and I met in 2012. So I guess we're going on 9 years, where he attempted to hire one of the vice presidents from Gentiva Home Health when I was playing the role of a branch director over there. She declined his offer, and she asked if she can throw someone's name in the hat. And I was not looking. I was content. And she came to me. Her name was Lynn D. McCallie, and told me she feels that this is the right opportunity for me, which happened to be the vice president of operations for the home care service line.
At Silverado.
At Silverado.
Got it, okay.
So I met Randy, and I've never had an interview like I did with Randy, and I've told him that to this day. I mean, there's two incredible things about him that I'll say real quick, and then I'll stop. Number one was the atmosphere he created during the interview was unlike any that I ever heard. Warm, welcome, the most comfortable I've ever been yet.
Were you in a professional setting, or was this
his office?
Like a
My
night, an evening?
Nope, my office.
Okay, very professional. Okay, sterile environment.
Not my office. It's not very sterile. It's pretty down to earth.
An office.
Yeah.
Got it.
Yeah. So at that point, after our interview, he offered me the job, and I took it, and really. I worked for Randy there at Silverado for about 2.5 years.
Okay.
And really, the way I looked at my career at that point was, upon his departure, I had undergone more personal and professional development in those 2 years with Randy than I did in my entire healthcare career, which spanned, 14 years prior to that. And that was really his, it was the way that he leads.
Are you sure?
Oh, I know. It's surprising, right?
He may know
We're just
another,
having
he may
a
know
good time.
another
We were
side of
having
me.
a
You
good
don't
time.
know,
We were
Rodney. He
having
may
a
know
great
something
time.
that you don't know.
So I tell the story as he developed me into his partner.
Right.
Yeah.
That's amazing. Kudos to you.
Yeah, thank you. It was easy to do with somebody like Rodney.
Yeah.
Yeah, my story is very different because he is an equal partner in every way. The business is successful because of him, and I saw that early on. So he ran a great division for us at Silverado when I was there in a leadership role, and we've been great partners from the day we penciled the company here. And it was late July of 2016 when we started. At that time, Post-Acute Care Partners was the legal name. We DBA'd the company Care Partners at Home, and that's kind of where the foundation began.
So you disembarked Silverado
I
in
did.
what year?
I left in 2015.
Okay.
And that's an interesting story. I'll tell that story real quick. I left and was being recruited by a couple of companies. Actually, the Mars Corporation was recruiting me to run worldwide pet operations for Banfield Pets, which is all of the veterinary medicine stores and vets within Petcos throughout, PetSmarts throughout the country.
Got it.
And in 3 countries. So
Okay.
I was in the midst of Corey and I making a decision to move up to the north into Oregon. And Rodney said, hey, I'd like you to look at this business plan I wrote. He goes, I'm thinking about leaving and embarking on it. I'd like you to be an advisor, maybe a board member. And I was so intrigued by it. I knew how he works. And I said, why don't we decide to partner, and I'll invest and we'll go in.
And this was the
50-50
Care
partners.
Partners business plan. And so the doors opened in 16.
They opened 16.
Okay.
Technically, yeah.
Our first check was in December, $3,000,
Yeah.
roughly.
Okay, so this is why I asked you to come in here today. Again, thank you for the time. What we try and do here is cover a couple mediums, and one is certainly most of our advisors, as we talked about before, serve the financial planning space, and predominantly that audience is going to be seniors, boomers and seniors, and so providing some insight as to relates to just the world of healthcare today. We are definitely experts in long-term care planning and long-term care insurance, but there's a whole subset to that world that goes way beyond just planning for care. What does the real world of care look like today for families that are dealing with it every day and they're not equipped? So I really wanted to dive into the conversation with you as experts in that space, and also as 2 individuals that came together to form what is a growing business from ground zero, and the trials and tribulations that you've experienced, and where it is today and how it's evolved in a short period of time. So a lot to get to. I would ask you guys, where would you like to start?
Well, we could start in a variety of areas, but maybe we just share a little bit about the company structure, and that might be good for the advisors to know and for you to
Great idea.
work with. I mean, when we started the company, we really had a business plan that had all elements of what is considered the post-acute care healthcare space, so anything post-hospitalization. It had companion-level home care, which is a big part of our business today. But it also had skilled home health, which is really in-home rehab, nursing, therapy, speech therapy, occupational therapy. It also had hospice and palliative care, so managing quality of life during end of life and managing through that process. But Rodney and I really saw the future of healthcare, I think, in a very unique way. Not beyond anybody that are world experts, but we feel we're top 1% in what we do there. We knew that patients didn't want to have to be in the hospital, and if they could stay home, how can we help them? So companion caregiving made sense, but uniquely, Post-Acute Care Partners quickly was introduced to a company called Global Transitional Care Medical Group. And it is a unique Medicare-certified specialty medical group that provides physicians and nurse practitioners in the home with you when you're recovering post-discharge. So the element of that was many of these patients are the top 1% of patients who are the sickest of the sick, chronic disease, cycling in and out of the hospital and the emergency room, 3, 5, 10 times a year. And nobody set them down to say, what does your life really mean to you, and what do you want to do? You want to keep going back to the hospital? And some say yes. But predominantly, they're looking for ways in which to have their care managed outside of home, which might even be, how do I die without revolving in and out of the ER and have a quality of life? So how do I, take advantage of palliative medicine or hospice? So we do all of that clinical education, and we basically are house call physicians. So we have now acquired Global Transitional Care, which is now Care Partners Medicine. It was the only nationally recognized Medicare certified practice in the country, and still is today. So it's very unique. And our relationships are with hospitals, large health systems, and insurance companies, health insurance plans, delivering transitional medicine. And so it's really become a paradigm shift, and the industry is starting to catch up to where we are. In fact, we were early. We didn't make money at this. We actually lost money at this. We saw that it was an advantage we needed to be in to be a disruptor in the space. And that has led us into other aspects of our business where we are now in primary care medicine. So just like your family practitioner, we actually do primary care medicine in a very unique environment, which is also an insurance-based environment, which is the PACE program. It's Medicare certified. That program is the program for the all-inclusive care of the elderly, and we staff the medical group that provides that 360-degree level of care. And that primary medicine is now growing, and we're actually going to start offices throughout Orange County, actually 5 offices in the coming months. So that makes up the kind of 3 sectors of our business that are with us today. The final sector is the acute care hospital at home model. So we've been tapped by UCI Health System to do the acute care hospital at home program, where patients, and this started through COVID, this started as a result of the emergency order for pandemics. The president allowed hospitals to sign a waiver to treat patients as inpatients, but actually in their home. And so it's pretty unique. So they've tapped us to provide the entire hospital bedroom and care that revolves around that in a patient's home if they're qualified. So not just now COVID diagnosis, we'll see patients with chronic obstructive pulmonary disease, we'll see cardiac patients with CHF. So we have the ability to bring them home, and that pilot is kicking off, and we're now being tapped by other health systems to do that. So we really have our arms in 4 areas of the post-acute care space. So that's a backdrop on who.
And this is all California, predominantly Southern California.
Currently, yes. We have pretty big desires to expand, and I think that will be something you see from us in 2022.
We have expanded in Sacramento. So our medical group is in Sacramento as we speak, and we're looking to acquire non-medical home care up there as well to support.
Yeah, one of the things, just take a big step back, that we find on a pretty regular basis with our financial advisors and in turn their customers is this confusion regarding Medicaid, Medi-Cal, and the belief that it provides extended care beyond what the hospital can provide them, and it's not an accurate truth unless we're pretty much poverty stricken, right? So
correct.
Or destitute, and you probably have pretty good exposure to those types of facilities. What do they look like? What does a Medicaid, Medi-Cal facility look like, as opposed to, so let me just use a perfect example, an extreme opposite, Cresta Villa.
Right. Complete opposite spectrum.
Yeah, so there's facility care, there's home care, the world of and the whole process moving towards providing quality levels of care to those in need in home. You're evident that this is dramatically increasing, right?
Absolutely.
But I would also imagine that the audience at large has no wherewithal of how to properly navigate these waters. They do it in real time. So the other question I have is, how can they?
Or they do it late.
Right. That it's
Too late.
It's crisis planning. It's response to a crisis, and that's the worst time, as opposed to having some awareness and education in how to be better equipped for if my mom or my dad or what have you, or worse, I'm left by myself dealing with these types of situations, and the hospitals want to do what? Discharge. And then what do I do from there? So it's just such a I don't know. It's a very scary and tenuous place to be at the wrong time of a person's life. So, any insight that you guys can provide and enlighten, just as it relates to first of all, where do you exactly step in, firms like yours, to help a family or the person in need of care when they're out on the who connects the dot from the hospital to your organization? How does that even work?
Yeah. Let's do this. Let's do two things, because you asked two great questions. I think I'll take part of the initial question, and then you take the flow of how we connect. You mentioned the facilities. You mentioned the different types of facilities that are Medicaid or here in California, Medi-Cal based.
Correct.
And there's a broad spectrum. If you're not well planned from an insurance perspective, long-term care insurance perspective, and you have a really chronic disabling disease, you could end up in a Medicare long-term care facility. And I'm always careful because, people who do long-term care, many do it well-intended, but it's not a place you ultimately want to be. And there's bad actors in it as well,
yeah.
Right? But they're not places that I would want my loved one to be, even the ones that are trying to do it right, because you have such chronic disease, you have a risk of infection, you have a lot of exposure. And people who don't have the resources end up there utilizing their Medicare and Medi-Cal benefit, which is basically at that point just a room and board benefit, and Medicare's providing the health care coverage. And that's an individual who has not planned for their future, right? They haven't talked about long-term care insurance, or they didn't have the wherewithal to have a secondary health plan, right, to cover their Medicare. So there's some pretty frightening places throughout not only the state of California, but throughout the country.
Absolutely.
And we come across those. And so there's those elements. There's also the elements of the 6-bed board and care, which can be a very appropriate place, but there's all different spectrums of operators, right? There are the bad actors who are just looking to, put 6 people in a home and do it to the minimal degree, and it becomes a very frightening experience for families.
Right.
They lose control. And then there are those who do it right. So, there's that broad spectrum. And so you asked about the different facilities that people can face, but they end up there not being properly prepared. And then the one thing I would add, and I think Rodney can do a great job kind of taking you through how we get involved, is you talked about the patients themselves or the individuals themselves who are boomers, or the few that are the forgotten generation that are still living. Well, there's also you, Scott, and there's me and Rodney, and we have to plan too. And I think that's one of the things we sometimes forget is that, we're dealing with our parents and even our grandparents, but we find that we talk to a lot of those adults who are in the crisis, and they're within the, late 30s to late 50s, and that's a 20-year span. But those are the folks that really need to be planning for what they're dealing with. And the crisis really opens their eyes. And we can talk a little bit about that too.
Okay.
Yeah. So where we come into the equation is really on two different points when you're looking at the medical group versus the non-medical side. One, I will say, is proactive, one's reactive. When you look at us as a disruptor, we're trying to put the two together. And so when we get asked about, well, why'd you do a medical group and non-medical? Well, the biggest piece is the non-medical space is predominantly private pay, right? We have a little bit of VA pay. We have a little bit of long-term care for those who have actually planned, and then the majority of it's private pay. Why there's 300 competitors in Orange County alone is because it's an affluent county. So there's going to be a higher percentage of folks who can pay for it. But even in an affluent county like this, we still have over 70% of the millions of people who live here who can't afford the care needed when it comes time for that care needed. And that's predominantly just in the non-medical space, not even looking at the insurance coverages that might cover that home health, hospice, or hospitalization benefit. So the reactive side on the non-medical is a lot of times at the hospital, at the skilled nursing facility, at the LTAC, which is long-term acute care that he mentioned. It's in crisis when mom or dad fell, or when there's a sudden diagnosis, or when cancer onset has occurred. And
a massive stroke
and so life has changed, and that's where the sons and daughters or family, if there is family, typically then are forced or thrust into a situation of saying, what do we do after the hospital? And maybe they already have that next step, because maybe going to a skilled nursing facility for further rehab post-hospital is the next step. So at least that's done in some of those. But after that, it's what's next. And that's where we come in on the non-medical side with a care management component, which is really that expert in post-acute care that really can guide families. They could take a unique family's picture, and this is financial, this is from an insurance standpoint, this is from a living conditions. You take all the social and psychosocial factors into that and can help look at putting together a short-term or long-term plan for that family with setting appropriate expectations that no matter how we plan, it's very rare that we follow that perfect plan because this is based upon many factors, and that's the healing factor, right? Purpose plays a role in this.
Yeah.
We find that clients who have less purpose or less desire to understand maybe the chronic illnesses that they're going through, or less fight, take different paths than others who sometimes exhibit that and are given smaller chances and really, come out better than expected.
What are your thoughts on that mindset? What drives that purpose for a person? Is it, I would think, family, being close to them, or completely vacant from them would obviously have a huge impact. I don't know.
I love that question. It's human connection. And
Yeah.
it's human connection through and through. We've cared for people who have no purpose. And when we talk about intricately matching, strangers, this is caregiver to a client with some sense of needs. We've actually seen, and this is where you wish that you had all the tools to measure it, right? How do you measure somebody's purpose, right? A lot of times it's just going to be in depression, anxiety, all of these other things that might have scales to measure. But we've seen clients essentially come back to life. They don't have family. There is no purpose. They don't care if they die, honestly. And you end up matching them with somebody or a team around them that just connects. And suddenly they're engaging. And through that engagement, maybe there's encouragement to say, you know what, maybe you should have a better diet. Maybe we should get outside and go do something. So that matching component is a key piece that in all of our service lines, it is the gold that we have found that is really one of the immeasurable KPIs that has been the build of our brand and our business. And it's the stories that are coming out of our patients and clients' homes when you match them with the right team that is there purposefully caring for somebody because that's their why and that's their purpose. And it brings that out when you have that match.
What does the matchmaking process look like?
It's a good question, actually. It's a pretty comprehensive.
As I go back to when you and I first, when we were talking about your organization this a couple of years ago, we also touched on dementia and Alzheimer's and how, mind is the most miraculous thing in the world, right? And there's so many levels of dementia based in anger, based in fear, based in anxiety, and skill sets are required of each of those.
Right.
Well, how do I place that?
Right, and that's where I think that's where our experts come into play. And a disproportionate number of our clients have a cognitive impairment, a dementia, an Alzheimer's disease, and all of those, as you said, it's got at different levels of progression. And so it's how we hire that makes the difference. And I think we're happy to tell our story, and we're happy to give away every trade secret we have because we know how we as a company operated with our culture. Mm-hmm. And so hiring is a huge differentiator for us. So we hire people who have it in their hearts, who have the understanding of what it takes to be with somebody and not be upset when somebody with dementia is aggressive, or not be upset when somebody who has dementia is yelling at them or using profanity. People take that very personally, and it becomes a defense mechanism. And a caregiver has to be able to disassociate themselves from the individual's behavior and help redirect them. And so hiring is the key to our success. And Rodney and I, to this day, I think we've spoken or interviewed just about every one of the 500 employees in our company. And there's a fundamental philosophy for Rodney and for me, and actually for our team. Our organization has an organizational chart, right? Structurally, every company does. You've got somebody at the quote-unquote top, and then it matriculates down into leadership and regions, and then the people who maybe do the direct delivery of care.
Right.
Our organizational chart is completely upside down. The flat base of the pyramid is the top of our chain. We, Rodney and I, we're there to serve everybody that is above us. The point is where we're balanced. Our job is to make sure they have the resources they need, to make sure families have people on our team who culturally are able to fit the desired impact that they need. It might be, hey, we need somebody who's male. We need somebody who's female. Those are basic requests. But we need somebody who's willing to talk to mom and delve into her history and pull out some of the person who she was before her dementia took over. That takes a really educated person, but it takes somebody who has high emotional intelligence. And so that's really the fundamental piece of the caregivers that we have on our team. And that's kind of how we build it.
And so your culture clearly, breeds that, and you were probably born with that culture when you formed this organization. How have you hold that intact? What is your mission and purpose? And because I could just imagine how stressful it is to provide care for some of these people in the situations that they're in, and your heart just kills for them, I'm
going to tell a story real quick, and I haven't told this story. So when we started the company, you jogged my memory. Rodney and I have run large organizations. We've had hundreds of employees report to us. We've taken companies through, multi-state navigations. But when Rodney and I came together, we were caregivers. We went back to our roots. We did adult brief changing for a family because our caregiver needed assistance, and so we ran over to the house to do that. We went in and did Hoyer lift training. So Hoyer lift, lifts a patient who can't lift themselves. Those were things that, I did 25, 30 years ago, Rodney did 15 years ago. And so
you found yourself right back to ground zero.
Absolutely. And that was such a beautiful experience for me, and I know for Rodney. We actually went to a hospital where a young man was having surgery but took his mom because no one would watch him. And we had to go to the hospital and stay with her. We had a caregiver there, but the patient started to react, and it wasn't a good situation. At 10 o'clock at night, and this isn't about Rodney and I, by the way, but at 10 o'clock at night, I got a call, or Rodney got a call, and we said, let's just go. Got out of bed, off we went to the hospital, and we stayed until the son was out of surgery. We got her, settled down. We got her redirected. And for me, that was incredibly fulfilling. There was stress involved, right? But the fulfillment that we get, we try to take that every day now that the company's become large, and we try to reinstill that in people every day that we're out. And we try to walk a mile with them. And I think that's one of the things that when we started the company, we put 3 core tenets in our mission, vision, and values, which was we'll deliver love, empathy, and compassion. Now, you may think for a Harvard Business Review, who's going to touch that, right? Well, I'll tell you, the financial performance of our organization is a direct reflection of the people that work in our organization that display love, empathy, and compassion. And that is a big part of our returning customer base, or families telling other families about who we are. So that's been a core piece of who we are.
And if I can add one thing, I'll say we're a storytelling company. So how we started it was we actually brought in a company and told our stories on video. And those videos have had more than $1 million ROI on clients telling us they originally came to the company because of that. Every meeting we have starts with stories. So if we have an hour-long operations meeting, 30 minutes is really success stories around the room. What are we hearing from our patients' homes? Folks sharing the death of a loved one, and while from a KPI standpoint, that's lost census, that's lost revenue, but sharing a story that was so impactful that your employees, your associates are referred to as God sends, angels on earth. That's the meaning that drives. And if we're hiring the right people sitting around that table, that's the constant driver through the stress. That's what makes work not feel like work. That's what makes it feel like something you love.
That's purpose for us. That's the true essence of purpose for Rodney and I. And I don't think that we ever thought about what the company's ability to scale would be, because naturally we're good businessmen, and we don't take that for granted. But now we have a model that we can basically replicate wherever we go. But it's not about just adding bodies. It's going to take people. I think my biggest concern, me as the CEO of the organization, is when we go to state number 2, who are we going to hire to represent Care Partners brand? Who is going to understand what Rodney and Randy what Sue and Marco, and these are other people on our team,
Yep.
really bring to the table.
Right, right.
And so that is our job, and we'll do it, but it's one of those scenarios where if we can get those right people in place, the scalability of the organization becomes very simple.
Yeah, it's interesting because you have a people organization, and as a company scales, it's always quality control.
Correct.
You know, if I make XYZ product, how do I, as I scale, how do I maintain the core of this organization or this product that we've worked so hard to build? And that's always just an interesting and challenging journey.
Well, it's the human capital equation, right? Is trying to figure out, scale. We've watched successful companies scale and succeed. We've also watched successful companies scale and fail, right?
Unravel.
Right.
Yeah.
And it's because of that, I think we believe that's what has to happen for the built to last mentality. And I think that's where we're headed with our organization.
So on the funding, the private pay side, what do the psychographics, demographics, the fluency level of this clientele look like? How do they find you, and what does the cost structure look like?
So again, as you heard, for those who can afford it, let's call them the affluent, it depends on what the needs are, but most needs always grow. So the typical thing you'll see in home care is a client who isn't in that crisis mode, but family has a very close family support that has recognized, whether it be some activity of daily living, that could be walking, dressing, bathing, that they're starting to slow down, or maybe there's a safety risk, and maybe there's
a need for part-time caregiving during the day.
Sure.
Right.
And maybe they all agreed as a family, we're going to try to get mom and dad to stay in the home as long as possible before we do look at, residential care.
Yep.
And those...
I'm dying in this home.
Right.
Yeah. Yep. There's 3-4 hour shifts, and so there's a much greater population that can afford that, because we do see a greater VA pay, the initial long-term care pay, and then
Some
families
benefits. Yeah.
and then families coming around to be able to support that. So $25 to $35 an hour is the average. So if you just take 10 hours a week at 30, $300 a week is now $1,200 a month into their budget. On the opposite side, clients who are getting 24-hour care, you're looking at upwards of $15,000 to $20,000 a month in private pay, and so that's $250,000 a year.
Right.
And when you look at those 300 agencies who are playing in this space just here in Orange County, that's why so much of the marketing efforts that you'll see geared towards communities like Ladera Ranch, like Codo, like Coastal from Laguna Beach to Huntington Beach, because the percentage of the population that can afford that care as it's needed is much greater.
And so on that, over the last 5 years, how have you seen the growth in that hourly rate change?
Pretty dramatic. So two things have affected it. One, the minimum wage, right, that was legislated in 2015 to go up $1 an hour for minimum wage earners. That has an impact on us. Definitely COVID has had a significant impact on us. The availability of the workforce, some got sick, some got frightened, so we actually had to incentivize people to work at a higher rate of pay. So those have been two very strong economic impacts, and we've had to pass that along to customers and the consumer. So that's industry wide. That's not just us. And so those are two big areas. You mentioned something in your question that I think is important for as advisors and thinking about your audience. The middle income, the upper middle income, and the affluent that Rodney had mentioned, they are all purchasing our services privately, and it's you and me, Scott, if we were brothers, pulling our money together because mom has some money, but we feel she needs more care. So, we're going to go 50-50 on, 10 additional hours a week.
Right.
We often see services discounted before they started because they think they can't afford it. And I think this is a really interesting topic because accessing their benefit, let's say it's a long-term care benefit, or accessing resources they might have financially, people think that they're going to outlive their economic resources. And often our care managers, while they're not financial advisors, they can help lay out for family, and sadly, but true, what the potential economic impact's going to be and the average life expectancy of somebody who has a late-stage Alzheimer's disease, right? Some can live 10, 12, 15 years. The surprising factor is when you're making decisions like this, the average life expectancy is about 28 months. And so there's calculators that can kind of work through that, so you can really look at the the economic benefit that family may either have to come up with or utilize resources, or have health benefits in place or long-term care benefits in place. So it's a very interesting factor, and I think that 28-month window has been something that we've seen to be that's held true from our experience in senior living communities all the way through to post-acute companion home care.
Yeah, I mean, it's just one of those things as an advisor. If I'm really professing myself as, a comprehensive, holistic financial planner, pick a time frame, week, month, however many of my clients are either directly or indirectly impacted by a situation like this, and I don't need to be the expert rolling my sleeves up and helping with placement, but I am the one that becomes directly involved in helping to provide the added line item to their budget. And if I didn't do any pre-planning, I see this massive erosion or rapid erosion of their nest egg and wealth. And further, there's many choices that exist today. There's bad players and good players. Well, if nothing else, part of my clientele's life is on my shoulders as it relates to their fiscal livelihood. Well, this directly crosses over into making sure that at least they're aligned with an organization like yours that I know they're going to be in good hands. And at least I'm an effective quarterback managing the relationship at such a critical time in their life.
So it's interesting you mentioned that, because I know you, Scott, and I know how you practice, and so that seems very natural. And I think the people on your team and those are around your organization, that's how they operate. And good referral sources for us are people like you who realize they can only quarterback, but they need a couple of offensive linemen. They need some people downfield to receive the ball. And so we play in that role. And I think the financial advising community has realized at some point the money needs to be spent. That's why you're saving it, right? And usually you're looking to do it and not spend it on your health care or on the downside of life. You want to enjoy it.
Right.
Or you want to leave a legacy, right?
Right.
You want to pass on a trust. But the reality is some of it can be accessed. And good advisors actually jump in and say, you need to talk to somebody like a case manager or Care Partners. And by the way, we're industry leaders in one unique way. We don't think our competitors are our competitors. We actually feel our competitors are to do well in the industry because we need to lift the industry up, especially in companion home care.
Right.
So you need to have a couple of resources around you, and that's what we end up doing. If we can't deliver it, we find resources so that family member has access points beyond us if we can't actually execute.
Yeah, we want to rise the tide together.
Correct.
Yeah.
Correct.
So how do individuals get connected? I mean, most of your referral sources or introductions to it's mostly institutional today, or is it word of mouth? And
if you saw our referral source list, it's tough to answer that question.
Okay.
It is the widest spectrum.
It's everything and everywhere.
It's everything and everywhere.
That's fascinating.
I'd say if you were to say where's the largest percentage, it's going to be other healthcare companies who recognize that, in building a village around a client or a patient can't be done by one company. And so a lot of the folks that we take care of are going to have multiple companies around them. We might have a patient who has our medical group as their transitional care provider, but also our home care providing caregiving. But there's a collection of organizations that we're going to call in the middle that are needed to further support. It could be home health with, the nursing component and therapy components, and also social work. Could be durable medical equipment that's needed in the home because there's a change. It could be pharmacy because of big pharmacy changes. And so a lot of times, again, where we play is the quarterback role from the physician level.
Many health insurance agents?
Yes.
Many.
Oh, yeah.
I would imagine, yeah.
Absolutely. It's also interesting how much social media, and every industry is impacted by social media, but it's also the place where every adult child is starting. even if they have a resource, they're hopping on to Yelp or Google, or they're they're checking Facebook, or they're Instagramming, they're getting into groups, discussion groups. And a big piece of our business, a larger percentage of our business today, comes through those sources.
Is that through deliberate optimization and marketing, pay for
Yeah.
It's direct Google ads and things like that, or is it more just through?
It's organic.
It is.
Yeah, it's
Wow.
largely organic. We're moving more into the SEO space as far as the proper keyword selection and paying for that performance. But really, the organic piece is that our Yelp reviews, our Google reviews, are not just the friend asked me to say something nice about the company or the organization. If you get on our website, if you look at carepartners.com or .us. What's amazing to us is it's paragraphs of success stories or thank yous, and it's naming caregivers, it's naming the organization, it's talking about their family experience, and those translate incredibly well, because that's when I stop. If I'm looking at Yelp, I'm looking at Yelp to say, okay, was there a meaningful interaction, whether I'm buying a product or a service? And that's been, I think, a real business builder for us. Wouldn't you agree?
Yeah, we invested in SEO non-paid for, I want to say, about almost 2 years. And it was really about trusting them, knowing that you don't get results overnight,
Right.
trusting them and guiding us. And how we selected them was how we've selected every partner that's come alongside of us in this journey, from the beginning of just non-medical into the disruption of involving the medical group. And the partner had similar mission, vision, and values. And I don't mind sharing, it's Lighthouse Graphics. But the CEO came in and met with us, and we shared stories. And just like you said in the beginning, all of us are indirectly or directly involved in some aspect of a story, whether it's considered positive or negative. Mm-hmm. We connected over that. He really got to know us. And his proposal came back not as a proposal that is typical,
Fee for
cut and
service.
paste.
Oh, right.
It was, here's what we think we can do for you. And our brand was very young then, and they've done exactly that. Our organic traffic has just climbed mountains, and our rankings on pages has climbed mountains. So now's the time where we've been advised, now let's start to move into Google Analytics and start to get paid traffic as well, because it is an overly saturated market. And the goal
so how
for
do you
us-
fight your way into that market share and just spread, widen the moat?
You try to, you really try to focus on your differentiators. For us, the first part is free. Just talk with one of our care managers. And that goes for professionals, like you, elder law attorneys, financial planners, brokers. You have a client situation that you want advice on, we'll do it for free. And when you experience this setting with one of our care managers, a relationship will build in most cases. And that's what we've seen. Work with us once and you're going to see that they have your client's best interest in. So that's a differentiator for us. And again, it's the storytelling. If we can direct traffic to Yelp, to Google, to our web pages, they should see the same thing. What they see is what they get. We invite them into our office. And I know you've been in our office and experienced it. We've had marketing experts tell us 3 emotions they feel when they walk in our office. We have our associates tell us this. Our associates did not want to be remote during COVID. They wanted to physically be there because of the connection and because of the environment.
Yeah.
And those are 2 powerful things in this space. And if we can move that through social media and have people feel it through words, through pictures, through stories, we naturally will continue to see the expansion of the brand.
It's interesting. I was thinking about consumerism and how people make decisions. And you're entrusting us and other competitive organizations with the lives of your loved ones, right? But we shop for it just like we shop for a car or a product on Amazon. And so it's very impersonal, but it's the first place that people go when they're in fear or they're agonized over what to do with mom or dad or their spouse. And price shopping becomes the predominant player for us.
Right.
And, we are not a low-cost provider. We can't be to deliver the services we deliver.
Right.
But it's amazing to me. Usually, that's the first question: what does it cost?
What does it
and
cost?
that should really be question 10.
Yeah.
And I think what we try to do is answer that question, because it's a range of costs depending on what the needs are. And to get in and do an assessment, as Rodney said, we don't charge for that because it's not a sales pitch. They're calling because they have some level of need, whether it's 4 hours twice a week or whether it's 24-hour care live-in. And so we often maybe shopped by the consumer with 3 or 4 other agencies, and it comes down to pricing. And they may hear similar things from us and similar things from somebody else, but they're $3 an hour less. Well, that's the choice they make. We respect that choice. 9 times out of 10, they're calling our case managers to say, we don't have the right match. There's people revolving through the doors here. We're not sure that mom's safe. And so we're able to step back, because in that moment, there's so much fear and anxiety. And when you make a promise to your loved one, such as, you promise me, son, never to put me in a nursing home,
Yep.
or never put me in assisted living.
Right.
Look, that's a real discussion that everybody has.
Yeah.
And now you're responsible for that. And so you're also responsible for managing the financial resources, which you may have good control over because you've been included, or you may just be figuring out, God, what does mom have? What does exist? You don't know how often we say to a consumer, does mom have a long-term care insurance policy? I don't know. I'll have to check. I'm not sure what insurance she has. And it blows our minds.
Yeah.
And we find the policy, and then we help them navigate the policy. And it's great once they connect with the policy administrator, the ball starts rolling. And so you see people kind of relieve themselves and know that maybe 1/3 of the care or 50% of the care can be covered by long-term care insurance. And so those things, such as Rodney mentioned, VA benefits could come up against long-term care, right? There's ways in which we help them navigate that process. And that becomes a great exchange between advisors and brokers like yourselves and us as the experts, right? Because we would have to come back to you or to the insurance company to say, so how do we help the client optimize the policy that's at play? So we see that, we probably see that in about maybe 18% of our clients.
Okay. Wow, that's more than I would have expected, actually. So what's the best way that an advisor, a listener, can engage with care partners and develop that relationship?
Well, we have outreach, and it's always looking to develop those relationships. But the best way we've seen relationships form is their education that professionals are needing because of maybe issues they're facing with their clients or seeing them. Maybe there's been a collection of their clients that have gone to the hospital recently, and all of them have been, crises.
Mm-hmm.
And so for us, we love to sit down with professionals and say, is there any education we could provide? Is there a resource list we can provide based on maybe pain points you're having with your clients? Maybe it helps you to attract clients by saying, oh, I'm surrounding myself with organizations that, hopefully you or a loved one don't go through these things. But in the event you do, it won't be as much of a reactionary type of move, as much of a crisis. And again, if we go back to, the healing component of this, depression, anxiety, stress, all play a role in that. And the greater those are, either in the one going through it or the loved ones around, it's a negative effect on the healing or even the clinical outcome. And so it's how do we, as a society, continue to provide education or share resources based on the stories we've been through? Because not all our stories have been positive. There's been times where we've gone down 20 paths for clients who had nothing and looking for every way to find them the care needs that they needed, and they needed a lot. And
Right.
It was very exhausting and unfortunately sad in the fact of not being able to end that with saying, oh, at least we were able to connect them to this, or this.
Absolutely. Yeah.
The biggest thing, I think, is building trust with the family or the decision maker.
Yeah, within the community, of course.
And within the community,
Yeah.
too. Yeah, absolutely.
Are there things that, being that we sit here now, a year plus in, dealing with COVID and all of that, you did mention the core of your team wanted to stay in person and active in the office, and I think that's fantastic. But what about externally, the community at large, and what adaptions how did you have to adapt as an organization? What I've found at most companies, what might have been a 3 to 5 year plan, they quickly found we need to pivot within 6 months, 8 months, 4 months.
Our team blew us away, Scott. Within just one example, our recruiting team, so we have a big recruiting arm for caregivers, right, and other associates. They literally pivoted from an all-in-office, all-in-person interview within 7 days, went fully remote, fully video capable, put all of our application process online, all our state licensing per caregiver went online. it was amazing. Patty Lee runs that division for us, and her team did a phenomenal job. That's just one area. The caregivers in phase 1 of COVID, they were the epitome of first responders. I mean, they leaned in and said, "Where do you need me to go?"
Wow.
And that's before we knew we needed to wear masks, or everything was so uncertain, right? We were dealing this in the early, first month.
Late February, early March.
Absolutely.
Yeah.
And so we pivoted very well there. I think the team has also learned how to work like most companies have today. We won't be solely remote. We're going to have a blended workforce. We were already on a blended remote workforce because we want our associates to have options, and I think our workforce, we don't expect them to work 9 to 5. They work to get their jobs done, and we trust them to do that. So people may take off on Wednesday but work on Saturday, right? And so I think that helped prepare us for COVID because
and that was an environment or culture that
existed before, right? And so I think it was able to go. What else did we do?
I think a differentiator of having the medical group, our caregivers and our team have access to clinical and medical resources that most home care companies don't, because we have it inside, right? So having our chief medical officer and our physicians and nurses really become adept at what we were seeing and do real-time learning and adaptations also gave our field teams more comfort. And this is all the way into the nurse practitioners and physicians. We were the first on both the medical group side, the transitional care and home care, that said we will go see COVID patients and clients. And it wasn't with negligence. It was, we're going to put something together where we're going to look. We're not going to force our team in. We're going to offer for those who have raised their hands and said, I'm okay with doing this. And when you look at it today, 12 months later, we were just talking about an update that's going out on our website and our social media. We saw over 1,000 clients and patients, and we did not have one associate-to-associate transmission or associate-to-client or patient transmission across those 12 months, knock on wood.
Wow.
But that has to be the protocols and the adherence. We have to trust people who aren't in our office every day, who are living their own lives, and who probably saw COVID in very different ways as we've seen the society do. And what we did was not dive into their personal lives and say, when you're not at your clients, you can't be anywhere. What we did is say, make the right decisions. If you feel that you've been exposed or you've risked, make the right decision and do the right thing and allow us to replace you and move somebody else in while we, give you some time off and just make sure that you're okay. And when you look at 500 employees, from caregivers to physicians, to not have a transmission is pretty phenomenal. And that's with having about 55 employees over the course of this year test positive.
Wow,
we actually had a COVID committee led by our team within weeks of COVID being present, and we ended up doing internal COVID testing. We did rapid testings of our staff. We would deploy people out to the field to test our clients if needed. And it was very much an unknown factor, right? CDC was giving us information. We were provided guidance like many other healthcare companies and other retail companies. We just got out and did our best. And the COVID committee, I think, was a huge differentiator for what Rodney just reviewed, because we were able to do a tracking of who was that caregiver exposed to, where did it go, was it their family, was it our clients? And the fact that we were honest with families immediately, because it was such a great fear, it has been a great fear, families really embraced that we were saying, hey, look, Susie showed up, she was exposed to her son, he just tested positive, we're going to pull her out and put another caregiver in, and we're going to come test, or we're going to advise that you have your loved one tested. There was fear reacting to that, but the fact that we were honest and communicated, not one family member became upset. They said, look, you allowed us to deal with facts, and I think that was really helpful in kind of our success. And the team put that together without our involvement.
That's great insight. Yeah. Wow. So all that's here to stay?
It's here to stay. Absolutely. I mean, it's a new world for everybody. I mean, we're going to operate, as the pandemic settles, as we get consistent vaccination, as herd immunity comes into play for those who vaccinate and for those who don't, right? Because it's choice. It's going to improve. It's much like what we saw with, the flu. People can vaccinate, different strains of flu will come.
Right.
We're going to see this. But I think it has allowed us to operate differently. And quite frankly, our business became more innovative as a result. Sadly, many people in the world were affected by it, and death occurred. But we had a chance to pivot, and it has opened us up to new business opportunities. So the acute care hospital at home model that we started with, that was born out of pivoting around the COVID component. Deciding, that we want to be in primary medicine is giving a person a different resource and having that in-home connection. We also deployed telehealth, and we did that very rapidly. So the patients who didn't want our caregivers or our physicians and nurses in their home, we deployed a telehealth strategy where we could, call them up, FaceTime, have a video conference with them, and really, assess, diagnose, prescribe, and react. And we were surprised. Far fewer people took telehealth. They wanted their doctor to still come in person. They were gloved and gowned and masked.
Human interaction.
That's right. Human connection.
You cannot change that.
Yeah, absolutely.
So the website is?
www.carepartners.us.
Phone number?
949-556-3433. And I'm going to add one thing, Scott. You also can check us out at www.carepartnersmedicine.com. Two different websites, but that one highlights just the medical group and the transitional medicine piece, and the rest is a global website. And it's very fact-filled, so if you have questions, a lot of your questions can be answered there, and you can reach us.
Beautiful. Okay, I want one last thing. We need to talk, you and I, on how we actually met, which was through Senior Serve.
Yeah.
We would be remiss if we didn't take this opportunity to talk about what a wonderful organization this is and the opportunity that we have to serve. But there's no one better than you to probably talk about.
No, I don't believe that. You're great. You're great at it. I mean, I'm going to go back to maybe a little bit more intimate discussion before we talk about the organization. We met because of a great man.
Yes.
Don Lewis.
Yep.
And, Don died last year of cancer.
Yes.
And he really was a gentleman that brought me to the organization back in 2008. And, people on this podcast don't know Don, but I think if you've had a personal relationship with somebody who you just have a great respect for. I have few mentors in my life. I would put Don in the early days of my being involved with, at that time, Senior Serve, which is now Meals on Wheels Orange County. Don was somebody I could always find a true north in. And he was just a spectacular guy. And I know you were introduced to Don through a neighbor and became fastly probably enthralled with him. But yeah, so Meals on Wheels Orange County, it's been a passion project for you and I and several other board members. We now serve 18,000 meals a day, both in home delivered meals, and prior to the pandemic, we did it in congregate senior living centers. And the good fortune is those are starting to open back up, and there are about 24 of those congregate senior centers throughout the cities we serve. And Orange County Meals on Wheels serves northwest and central Orange County, so everything from Irvine North all the way out to Brea, all the way down to the coast up to Seal Beach. And it's been a labor of love for me. I think one of the things that I see is that we don't recognize that in our neighborhoods also are affected by this. And I'll tell one quick story. I think the thing that really caught me, the year into my first year there, I was asked to take over as CEO of the organization. And I really thought, I'm a healthcare leader. What's the relevance here? Well, it changed my life. It literally changed my life. I was, I was leaving the office, and one of the social workers at Orange County Meals on Wheels came up to me and said, Randy, we've tried to talk to this woman, but she has had a lot of social difficulties. She had been attacked just 10 years ago. Somebody broke into her home. She said, would you stop and see her? And she handed me the address, and I put the address in my pocket, and I drove home. And they said, it's up by your neighborhood, and I live in the Seal Beach, Los Alamitos area. I actually live in a community called Rossmore. And I stereotypically didn't look at the address. I got off the freeway, and I'm going to go back to where the high school is located, and there's a 55-plus motorhome community that's been there since 54.
Yep.
I got halfway there, drove past my neighborhood. I looked at the address, and the address was in my neighborhood.
Oh, wow.
So Rossmore homes, socioeconomically, home values, $1 million to $3 million.
Yep,
You don't think about it. Older neighborhood, built back in the 50s. So I turned and I navigated back, and it was an original home built in 1954. I approached the door. It's unusual because it actually had steel bars on the door. A screen door was a steel bar, and I thought, this is my neighborhood.
Right.
Nothing ever happens here.
Yeah.
But the woman came to the door, cracked the door open. She and her husband had been there since 1954. They had survived Auschwitz as child survivors of Auschwitz. She was attacked and raped 10 years prior to that. She was 80, so at 70. So she was very apprehensive of males. So I'm thinking, why am I here? I can only be a threat, right?
Right.
I talked to her. I told her what we've been trying to do to help her get some food in the home. And more importantly, she had no human connection. Within 10 minutes, she came outside. She wouldn't approach me too close. And I did something that was so odd for me. I was in my suit. I sat down on her driveway on the concrete. I said, let's sit down and talk. We talked for almost an hour, and it changed my life. And she took our meals. Our social worker was able to get in. And so for me, that's my moment at Meals on Wheels Orange County that made me realize I have to do something to be involved. And so I've served as the CEO for 2 years. I helped find my replacement, Holly Hagler, who lives today as a great president and CEO for the organization. And I serve with you on the board. So that's my story.
It's been a fun journey. Thank you for sharing that story. The mission, the burning desire for that organization, we talk about this all the time, is to do two things, end hunger and human isolation for these individuals within our community that are forgotten.
Absolutely.
And, shame on us.
And it's in every neighborhood. So don't stereotype it into inner city neighborhoods within Orange County. It's in Coto de Caza. It's in Newport Beach. People end up alone, and they don't intend typically to be that way. So I get a lot of joy out of it. I mean, I love working with you, Scott. You've been just great, and for the sake of not embarrassing you, I've really loved the way you've developed on our board, and I think you have offered so much, and we do have something in common. I think we sense this with how we operate in the board is we like to execute, we like to get things done, and I think you and I have had to learn to, watch the board and listen and be active, but I think you and I wanted, what's the next project? How are we going to solve this problem?
Right.
I love you for that.
There's no grass growing under our feet, so it's
No,
that sounds like a good idea. Okay, let's move forward. Then what next? No, we don't massage and deliberate.
Yeah.
Diplomacy is a learned trait and a skill that everyone can develop over their time.
Yeah.
It is a wonderful
It really is.
Passion project for sure. That's probably the right words.
Your kids are involved. Your wife's involved. I'm sure for you. What was it like taking them out to?
And all of our listeners get involved.
Yeah.
Reach out to me. Let us know. No, for us it was one of the experiences. So we've done this not obviously during the pandemic, but one of the things we've done the last few years is during the holidays we would take our kids, we'd get them out of school, and we would go do one of their delivery loops, and it's a life-changing experience. It really, really is a life-changing. There's no other way to describe it. What the conditions that some of these people are exposed to, and the limited access that they have to human interaction is shocking, to say the least. And so just by taking that 1 hour out of your day and just really brighten up their life and feed them a nutritionally balanced meal, which is so easy to do. But the reality of it is it's an almost impossible task for some people within the community. It is an impossible task, and it should not be,
It should not be. And we're looking for volunteers. We're looking for fundraising opportunities. So check out the organization, ocmealsonwheels.org, and you can always reach out, I'm sure, to Scott and myself.
Absolutely. Thank you both for coming in. This was very enlightening.
It was a pleasure.
Yeah, until next time.
Really enjoyed it.
Thanks for the opportunity.
Absolutely.
Thanks, man.